The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with Inside JACC, and we have a very interesting paper in press that deals with the important question of whether we should use ACE inhibitors or ARBs in patients with aortic stenosis. And here to discuss that with us is the senior author of the paper, Dr. Chim Lang. And Dr. Lang is professor of medicine at the University of Dundee and head of the academic unit. So tell us a little bit about the rationale of your study. Why is it we should consider using ACE inhibitors and ARBs, and is there any danger to using these drugs?
Right, thank you, Dr. DeMaria. I think we now recognize that in the patients with aortic stenosis that there are maladaptive changes that occur beyond the aortic valve, such as LV dysfunction, and all these maladaptive changes, the ACE inhibitors might have a role to counteract these effects.
And is there a concern about producing some hypotension with the ACE inhibitors?
Well, I think the concern about ACE inhibitors relates to its vasodilatory effects, and these might be a concern in patients with critical aortic stenosis, but in patients with moderate aortic stenosis or less critical aortic stenosis, I think there is less concern of its use in that cohort of patients.
Well, you were able to exploit a really unique database to try to answer the question about the value of ACE inhibitors and ARBs in aortic stenosis. Describe that to us quickly.
Yeah, I think in Dundee we have a very powerful bioinformatics platform that links an echo database to a prescribing database and an outcome database. And this allowed us to do a longitudinal retrospective population cohort study.
Now, when you compared those patients with aortic stenosis who were on ACE inhibitors or ARBs with patients who weren't, what did you find?
Right. The key finding was that we found that in patients that had been prescribed an ACE inhibitor or an ARB, there was a striking 24% relative risk reduction in all-cause mortality and also a 23% relative low risk of cardiovascular events.
Really a rather striking benefit. Of course, I guess we have to temper that with the fact that it was an observational retrospective study from a database, and it does have some limitations, doesn't it?
Yes, we recognize the inherent limitations of a retrospective study, but importantly, we've done some sensitivity analysis, including propensity matched cohort analysis, as well as time-dependent analysis, and the findings were still the same. But also importantly, the very patients that received any ACE inhibitors, they had a higher baseline risk, i.e. these patients were more likely to be diabetic, had LV dysfunction, and consequently had a previous cardiovascular event. So we think that despite this higher baseline risk, they still had a better outcome. So I think taking all these together, we think these findings are very exciting.
Oh, I quite agree. I think this is a very important paper. For those of us who are encountering patients with aortic stenosis and we feel they have the need for ACE inhibitors or ARBs, we now have some very reassuring data from your study, and in fact in the future we may apply these to patients just because of the presence of aortic stenosis. Thanks very much for being with us.
Thank you.
For Inside JACC, I'm Tony DeMaria.